Hello, everybody, and welcome to the Nutty Niche News today, April 3rd, 2025. And in the news today, this is coming out by Denver Health Journeys. And we've got a heck of a problem here going across the United States here, folks. Fentanyl poisonings are rising sharply among U.S. children. The number of children in the U.S. exposed to fentanyl has skyrocketed in recent years, and the outcomes are becoming more severe. This new study, co authored by Joshua Black, a Ph.D. senior scientist at Denver Health and Rocky Mountain Poison and Drug Safety, found that pediatric exposures to fentanyl reported to U.S. poison control centers between 2015 and 2023 increased by 924% in children 12 or younger. Folks, that's children 12 and under, 924% in reported fentanyl poisoning. And it's 1,506% in our teenagers. That's a heck of an increase right there. We're losing teenagers today, folks, left and right. So please talk to your children. While the numbers alone are alarming, more than 13, oh, while the numbers alone are alarming, more than 3,000 non-fatal cases during the study period, experts are deeply concerned about the nature of those cases. During that study period, 3,000 non-fatal cases. That's a lot. The severity of the exposures has gotten worse over time, Black says. What used to be around 40%, no effect, meaning the child was exposed but had no outward effect to it, that's dropped to around 12%. In 2023, nearly 45% of pediatric cases were considered life threatening, meaning the child most likely would have died without treatment. That's up from 16% in 2015. What? That's a lot. 30%, folks. That's a 30% rise. Deaths are also rising at an alarming rate. More than 5,000 children in the U.S. have died from fentanyl overdoses in the past 2 decades. More than half of those happened in the first 2 years of the COVID-19 pandemic. There were about 1,550 pediatric deaths from fentanyl in 2021, or 30 times more than in 2013. Wow, that's unacceptable. Knowing the sign zone, being prepared. The overwhelming majority of exposures for young children were unintentional. These were mostly cases of kids getting into something, whether a product, paraphernalia, that may have had some residue on it. But among teens, it's a different story. For 13 to 19-year-olds, it's predominantly misused, with those children intentionally using it in some form of effect. This kind of data, pulled from more than 50 poison centers across 49 states, has, however, been studied at this scale for non fatal exposures. It points to an urgent need for education, prevention, and preparation. It starts with recordings of the signs of exposure, which is a pale, complex, slow breathing, falling unconscious, or seizing, which indicates a need to call 911. Folks, if you have Narcan, administer it immediately. If you or someone you know has been exposed to a poison or toxin, call the Poison Helpline at 1 800 222 1222. Use the Poison Help Desk, or to get immediate assistance, 911. So, folks, we got a major problem here going on across the country here in fentanyl. I hate seeing those videos. Forever 21, Forever 12. Forever 15, Forever 18. Those are tough videos to see, folks. As parents, we're not supposed to bury our children. They're supposed to bury us. And lose a child as a teenager. That's man. They had their whole life ahead of them. Narcan, 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 folks. Everybody get Narcan. Carry it in your car, carry it in your purse, ladies. Carry it. Put it on a necklace around your neck. Narcan, Narcan. You never know when you're going to need it. Carry more than one dose. They travel in groups. Folks, thank you very much for tuning in. This is the Nutty Niche News. Have a great day.